Welcome to This Week in Medicine, your filtered medical journal summary. Looking to stay up to date with the latest medical research but short on time? This Week in Medicine has you covered. Our AI-generated podcast provides you with a convenient, on-the-go solution to keep you informed about the most significant developments in the medicine field. Each episode offers a filtered and concentrated summary of key journal articles, allowing you to stay informed without the need to sift through pages of research papers. With This Week in Medicine, listening is faster than reading, and you can consume valuable medical knowledge while commuting, exercising, or during your daily routine.
Hi, This Week in Medicine, we will be discussing. First, we will be discussing articles in New England Journal of Medicine. Hypertonic saline or carbocisteine in bronchiectasis. Background. Bronchiectasis guidelines are inconsistent with regard to the effectiveness of mucoactive agents, and their use varies geographically. Large trials are needed to assess safety and effectiveness. Conclusions. In participants with bronchiectasis, neither hypertonic saline nor carbocisteine significantly reduced the mean incidence of pulmonary exacerbations over a period of 52 weeks. Next article. Aspirin in patients with chronic coronary syndrome receiving oral anticoagulation. Background. The appropriate antithrombotic regimen for patients with chronic coronary syndrome, who are at high atherothrombotic risk and receiving long-term oral anticoagulation, remains unknown. Conclusions. Among patients with chronic coronary syndrome at high atherothrombotic risk, who were receiving an oral anticoagulant, the addition of aspirin led to a higher risk of cardiovascular death, myocardial infarction, stroke, systemic embolism, coronary revascularization, or acute limb ischemia than placebo, as well as higher risks of death from any cause and major bleeding. Next article. Common diseases in clinical cohorts, not always what they seem. Background. Misdiagnosis or underdiagnosis of rare diseases in patients with diagnoses of common diseases can lead to delayed or inappropriate treatments, thereby complicating the management of both rare and common conditions. Despite advances in molecular diagnostic techniques, the effect of rare diseases on the diagnosis of common diseases in research and clinical trials has not been comprehensively investigated. Conclusions. Our study shows the value of systematic genome sequencing in understanding the phenotypic heterogeneity of common diseases and identifying failure to diagnose rare diseases, and highlights the benefits of deep molecular phenotyping in clinical trials and patient care. Next article. Sotatercept for pulmonary arterial hypertension within the first year after diagnosis. Background. Sotatercept, an activin signaling inhibitor, reduces morbidity and mortality among patients with long-standing pulmonary arterial hypertension. Its effects in patients with pulmonary arterial hypertension within the first year after diagnosis are unclear. Conclusions. Among adults with pulmonary arterial hypertension who had received the diagnosis less than 1 year earlier, the addition of Sotatercept to background therapy resulted in a lower risk of clinical worsening than placebo. Next, we will be discussing articles from Journal of American Medical Association. Bioresorbable versus metallic occluders for transcatheter atrial septal defect closure. Question. Are bioresorbable occluders non-inferior to metallic devices for transcatheter atrial septal defect (ASD) closure while exhibiting evidence of biodegradation? Findings. In this multicenter randomized non-inferiority trial including 230 participants with secundum ASD, a bioresorbable occluder demonstrated a comparable 6-month ASD closure success rate, 96.5% versus 97.4% with a metallic occluder, and achieved near-complete degradation, approximately 99.8%, at 2 years, meaning a bioresorbable occluder is non-inferior to a metallic occluder for ASD closure, with near-complete degradation by 2 years, offering a valuable transcatheter option. Next, we will be discussing articles from Annals of Internal Medicine. Trends in cancer incidence in younger and older adults, an international comparative analysis. Background. There is concern about widespread increases in cancer incidence rates in younger adults. Subjective. To compare international cancer incidence trends in younger adults, aged 20 to 49 years, and older adults, aged greater than or equal to 50 years. Conclusion. Cancer incidence rates increased for several cancer types in many of the countries studied. However, other than colorectal cancer, these increases occurred in both younger and older adults. These findings can help inform future research and clinical and public health guidelines. Next, we will be discussing articles from British Medical Journal. Sodium glucose cotransporter 2 inhibitors and risk of autoimmune rheumatic diseases. Objective to evaluate the use of sodium glucose cotransporter 2, SGLT2, inhibitors and risk of autoimmune rheumatic diseases in adults with type 2 diabetes. Conclusions. In this large cohort of adults with type 2 diabetes, SGLT2 inhibitors were associated with an 11% lower risk of autoimmune rheumatic diseases compared with sulfonylureas. These results suggest that SGLT2 inhibitors may contribute to reducing the risk of autoimmune diseases. This potential benefit, however, should be carefully weighed against known adverse events and concerns about tolerability. Replication in other populations and settings, as well as studies in patients with existing autoimmune rheumatic diseases, are warranted to confirm and extend these observations. Next, we will be discussing articles in the field of hemato-oncology. Here are the articles from JAMA Oncology. Risk factors for valvulopathy among childhood cancer survivors. Question: which treatments are associated with increased risk of symptomatic valvular heart disease, VHD, in long-term childhood cancer survivors? Findings. In this case control study of 225 case patients and 442 controls, heart radiation therapy, high cumulative anthracycline doses, and exposure to platinum agents were associated with increased VHD risk. The heart radiation therapy dose response was exponential, and the risk increased with longer follow-up, meaning the risk for VHD appears more strongly concentrated at high doses of heart radiation and anthracyclines, with exponential dose-response associations observed for both exposures. Next, we will be discussing articles in the field of gastroenterology. Here are the articles from Gastroenterology. Dietary fiber modulates the window of susceptibility to Clostridioides difficile infection. Background and aims. Clostridioides difficile epidemiology is rapidly evolving, and understanding the factors that contribute to one's risk of C. difficile infection, CDI, is urgently needed. Based on our observations in a dietary intervention study, we hypothesized that fiber modulates susceptibility to C. difficile after antibiotic exposure, and investigated this using human specimens and murine models. Conclusions. Consumption of a low-fiber diet after antibiotic use contributes to a prolonged susceptibility to CDI that corresponds to a perturbation in both microbiota and bile acid composition. These results suggest that in the context of antibiotic treatment, diet is a critical, modifiable risk factor for CDI susceptibility. Here are the articles from Clinical Gastroenterology. Prevalence and pathophysiology of loose stools and their impact on clinical severity and quality of life in women with fecal incontinence. Objective: to compare the impact of fecal consistency with anorectal sphincter dysfunctions on clinical severity and quality of life, call, in women with fecal incontinence, FI. Background: FI affects up to 24% of middle-aged women, significantly impacting their call. Pathophysiological studies have focused more on sphincter and anorectal dysfunctions than on the role of fecal consistency. Conclusions. Fecal consistency of BSA greater than or equal to 5 significantly worsens clinical severity and call in women with FI. Specific diagnostic and therapeutic approaches addressing loose stools are needed before any rehabilitation treatment. Next, we will be discussing articles in the field of infectious diseases. Here are the articles from Clinical Infectious Diseases. Phase 1 evaluation of VH 4,524,184, a third-generation integrase strand transfer inhibitor with an enhanced resistance profile. Background: integrase strand transfer inhibitors, INSTIs, have been fundamental to human immunodeficiency virus type 1, HIV-1, treatment for over 15 years. VH 4,524,184, VH 184, is a third-generation INSTI with long-acting potential currently in development for HIV-1 treatment. Conclusions. These data support the safety and further development of VH 184 as a third-generation INSTI with long-acting potential for HIV-1 treatment. Next, we will be discussing articles in the field of rheumatology. Here are the articles from Journal of Clinical Rheumatology. A novel scoring system for diagnosing systemic lupus erythematosus-related cytopenias, insights from a cohort study. Objective: to develop a score for a diagnosis of cytopenias from systemic lupus erythematosus, SLE, activity and determine the usefulness of bone marrow aspirate and biopsy, BMA/BMB, in this population. Conclusion. Disease activity and drug-associated toxicity are the main causes of cytopenias in SLE patients. We developed a scoring system with acceptable diagnostic performance to detect disease activity as the cause of cytopenias in patients with SLE. Next, we will be discussing articles in the field of cardiology. Here are the articles from Circulation. Redefining the genetic architecture of hypertrophic cardiomyopathy, role of intermediate effect variants. Background. Hypertrophic cardiomyopathy, HCM, is a genetically heterogeneous disorder linked primarily to rare variants in sarcomeric genes, although recently certain non-sarcomeric genes have emerged as important contributors. Non-Mendelian genetic variants with reproducible moderate effect sizes and low penetrance, intermediate effect variants, EFs, can play a crucial role in modulating disease expression. Understanding the clinical impact of EFs is crucial to unravel the complex genetic architecture of HCM. Conclusions. EFs are present in 6.1% of HCM cases and account for 4.8% of HCM genetic burden. EFs also influence disease severity and outcomes, particularly when combined with monogenic disease-causing variants. Evaluation of EFs should be considered when HCM genetic testing is performed. Here are the articles from Journals of the American College of Cardiology. Trade-off between bleeding and ischemic events from left ventricular assist devices, a Euromax registry analysis. Background. A fully magnetically levitated centrifugal flow pump, HeartMate 3, HM3, has significantly reduced thromboembolic events in left ventricular assist device, LVAD, patients, potentially modifying the trade-off of ischemic and bleeding events. With current management strategies, the authors sought to characterize the opposing risk of ischemic and bleeding hemocompatibility-related adverse events, REAS, in lead carriers with contemporary practice. Conclusions. Advances in pump technology have significantly reduced REAS in real-world lead carriers, and have reshaped the balance between ischemic and bleeding risks under current management. The ongoing exceeding bleeding risk observed in contemporary practice underscores the urgent need for novel antithrombotic strategies that better align with the residual ischemic and bleeding profiles of LVAD patients. From JAMA Cardiology. Age-stratified effect of rivaroxaban monotherapy for atrial fibrillation in stable coronary artery disease. A post-hoc analysis of the A.I.O randomized clinical trial. Question. Does rivaroxaban monotherapy differ from rivaroxaban antiplatelet therapy in age-related effects on major adverse cardiovascular or bleeding events in atrial fibrillation, AF, and stable coronary artery disease, CAD? Findings. In this post-hoc analysis of the atrial fibrillation and ischemic events with rivaroxaban in patients with stable coronary artery disease, A.I.O randomized clinical trial data, rivaroxaban monotherapy showed consistent efficacy and safety across age groups. The net efficacy was more pronounced in older patients, whereas safety benefits were more evident in younger patients, meaning results reveal that rivaroxaban monotherapy yielded a consistent net clinical benefit across all age groups, especially in older patients with AF and stable CAD. Next, we will be discussing articles in the field of endocrinology. Here are the articles from Journal of Clinical Endocrinology and Metabolism. Using a composite summary of daily sex hormones to gauge time until menopause, a focus on pregnenolone glucuronide, PDG context. The timing of a woman's final menstrual period, FMP, in relation to her age, is considered a valuable indicator of overall health, being associated with cardiovascular, bone health, reproductive, and general mortality outcomes. Objective. This work aimed to evaluate the relationship between hormones and the time to FMP when daily hormone trajectories are characterized by their 1. Entropy and 2. Deviation from premenopausal/stable cycle patterns, representing a textbook gold standard, G's. Conclusion. Since PDG is generally not considered a predictor/descriptor of ovarian aging, this work validates the DTW/FUS-N analytical framework and introduces another metric/hormone to be used in FMP-related preventive care. Here are the articles from Diabetes Care. Differential effect of GLP-1 receptor agonists and SGLT2 inhibitors on lower extremity amputation outcomes in type 2 diabetes, a nationwide retrospective cohort study. Objective. To compare the risk of lower extremity amputations, LEAs, between new users of glucagon-like peptide-1 receptor agonists, GLP-1 RAS, versus sodium glucose cotransporter 2 inhibitors, SGLT2 conclusions. GLP-1 RA treatment was associated with greater major amputation-free survival compared with SGLT2I in people with type 2 diabetes, particularly in high-risk subgroups. Prospective studies are needed to confirm findings and inform selection of glucose-lowering therapies for people at risk for diabetes-related amputations. Next, we will be discussing articles in the field of neurology. Here are the articles from Neurology. Soccer heading exposure-dependent microstructural injury at depths of sulci in adult amateur players. Background and objectives. Repetitive head impacts, RHIs, in sports, are associated with adverse clinical and neuropathologic outcomes, but there is limited evidence from in vivo human imaging studies to inform risk assessment, exposure standards, and interventions. We tested the association of RHI with in vivo microstructural disruption at the depths of cerebral sulci, a region vulnerable to trauma. Discussion. Higher RHI exposure was associated with MRI measures of microstructural disruption at the depths of sulci in an exposure-dependent manner. By contrast, deep white matter regions were relatively insensitive to RHI effects. Diffusion MRI at the depths of sulci may serve as a more specific marker of RHI-related brain injury. Next, we will be discussing articles in the field of pulmonary and critical care. Here are the articles from Chest. Effect of ventilator mode on ventilator-free days in critically ill adults. A randomized clinical trial. Background. Whether the choice of ventilator mode affects outcomes for critically ill patients is unknown. Research question. What are the effects of 3 common ventilator modes, volume control versus pressure control versus adaptive pressure control, on death and duration of mechanical ventilation among critically ill adults? Interpretation. This pilot trial established the feasibility of conducting a cluster randomized crossover trial of ventilator mode among critically ill adults receiving invasive mechanical ventilation, and demonstrated differences in intermediate outcomes that warrant further investigation in a larger trial. Next, we will be discussing articles in the field of nephrology. Here are the articles from Clinical Journal of American Society of Nephrology. Comparative effectiveness of lubiprostone and stool softeners on risk of kidney outcomes in patients with CKD. Lubiprostone has been suggested to exert kidney protective effects by improving the gut microbiome in animal studies. This comparative effectiveness study examined the association of lubiprostone versus softeners use with kidney outcomes in patients with CKD. Lubiprostone versus softeners use was associated with a lower risk of progressive kidney function decline in patients with CKD and constipation. Here are the articles from Kidney International Reports randomized trial of dapagliflozin in patients with non-diabetic stage 4 CKD. Introduction. Sodium glucose cotransporter 2, SGLT2, inhibitors, are nephroprotective in patients with chronic kidney disease, CKD, and mild to moderate renal insufficiency (conclusion). Dapagliflozin safely ameliorates compensatory, glomerular hyperfiltration and proteinuria, and is glycosuric in non-diabetic patients with pre-terminal CKD. GFR reduction is likely because of post-glomerular vasodilation rather than preglomerular vasoconstriction.
Thank you for listening to This Week in Medicine, your filtered medical journal summary. Have a great week ahead, stay blessed and be humane.